I'm now going to invite Ms. Pascale Barnich, the General Manager of our partner, the Damien Foundation, to offer her remarks. And the Damien Foundation has long been a committed partner in the fight against Hansen's disease and advancing dignity and care for those affected. Pascale, s'il vous plaît.
Ladies and gentlemen, distinguished partners and friends, caring for others is an essential element of our human dignity, wherever we live in the world. This conviction has driven the Damien Foundation's commitment for more than 60 years. It guides each of our actions with populations affected by tuberculosis and neglected tropical skin diseases such as leprosy. We go beyond medical care. Our ambition is to strengthen the dignity, autonomy, and agency of individuals and communities. This approach is fully embedded in our work, grounded in the recognition of health as a fundamental right and in the fight against poverty. Poverty is both one of the main barriers to access health care and one of the key determinants in the chain of transmission of these diseases. It is the bond we build with people and their communities that inspire our action in responding to their needs. The Damien Foundation has always sought to closely link research and action as close as possible to the people affected, at the very heart of care for those who are ill. This has enabled us to develop a unique positioning and expertise, and the scientific research and innovation we support starts from local anchoring, from needs, from observing realities, and from identifying how we can improve care for each individual by working at all levels, from the individual to the health system, from local to global policies. A few years ago, the United Nations sets an ambitious goal to end extreme poverty and ensure health and well-being for all through the Sustainable Development Goals. These commitments were based on shared responsibility and on the conviction that international solidarity is an essential lever for building a fairer future. Today, the results that we have achieved through years of efforts are fragile. Inequalities are increasing and in many contexts worsening deep. The Hansen disease powerfully illustrates the close links between poverty, exclusion, and health. And it also shows how, by working in a holistic, coordinated, and solidarity-based way, we can change things for humanity. The elimination of leprosy is within reach. And to achieve this, I'd like to highlight what seems to us as priorities. At first, we need to continue supporting research to improve diagnostic. In the Comoros, the Damien Foundation, with the support of the Sasakawa Health Foundation and in collaboration with the Institute of Tropical Medicine in Antwerp, is conducting research to understand the mode of transmission and significantly reduce the risk of transmission, thereafter protecting families. After years of Hansen disease, we're still not fully aware of these modes of transmission. Relentlessly, we need to strengthen health system. Today, communities suffer from a lack of medical personnel trained to diagnose leprosy. And together with partners, we're seeking innovative solutions to strengthen skill and capacities. We need to continue poverty reduction programs. They are the best vaccines against leprosy. Last but not least, we need to strengthen the fight against judgment and false beliefs. These are the sources of stigma. It emphasizes differences but differences are also a source of richness. And therefore, the Damien Foundation continues to work in schools in Belgium. Indeed, education here and elsewhere is a cornerstone. It can reinforce exclusion, or it can become a key lever for creating societies where differences are strengths and drivers for a more just world. Whilst the legitimacy of international solidarity is questioned and resources are becoming scarcer, we need to choose to pursue our missions. Convinced that collective actions, knowledge sharing, and commitments are essential to building a world free from leprosy, stigma, and equipped with strong health and education systems. Because health and education are not privileged. Health and education are rights. Our commitment to human dignity remains unwavering. And therefore, we honor to join our forces to this global appeal to end stigma and discrimination against people affected by leprosy. Thank you.